Justice is the next normal. The COVID-19 crisis has revealed a lot about the United States. Certainly our resolve and our sense of unity. For many of us, it's been a time to cherish and rediscover the people important in our lives. But it also reveals failings in our national pandemic response, in our healthcare system. An economic shield for working families that seems to be made of Swiss cheese. And also the uniquely American phenomenon of mass incarceration. For many Americans, this is the first time that they're learning about a justice system that uses prisons as a catch-all solutions for many of the challenges in our poorest and most segregated neighborhoods. Mental illness, poverty, racial disparity, everything except safety, justice, and fairness, it seems. Now, in the name of sparing lives, during a historic outbreak, governors across the nation are releasing elderly prisoners, people with weeks left on their sentences, and many others deemed to be low risk. But in many ways, this doesn't go far enough. Decarceration as opposed to incarceration is becoming an essential part of justice. But this shouldn't be the justice plan for the future, the next normal. This is the way it always should have been. What we're doing today in the name of emergency should have been done yesterday in the name of humanity. And it's what we need to do tomorrow and a whole lot more. I want to welcome you all to this town hall, which launches this campaign, Justice is the Next Normal. Today's town hall is part of the Square One project, based out of Columbia University's Justice Lab. It brings together a diverse group of justice leaders from across the nation to reimagine justice in America. And we're going to start today with the story of how we got here to this place where we're exercising compassion and justice, but only during a crisis. This story is one of the greatest tragedies in modern American history. I can't think of anyone better to tell this than Khalil Gibran Muhammad, Professor of History, Race and Public Policy at Harvard University.
Thank you, Bruce. History is a powerful tool for recording the motivations and attitudes, the policies and practices, the very foundation of our humanity, the ties that bind us together. And in this moment of loss, of premature death, of great sacrifice and struggle, we find ourselves yet again at a historical crossroads. At a moment when we actually have the chance to face fearlessly the facts before us, as James Baldwin so often called us to do half a century ago. So in this moment of the coronavirus epidemic, we should take stock of the foundations of this nation and the very roots that help us to understand the difficult choices that we continue to make in terms of the value of human life. There's no other way to put it, but in the simplest of terms. The United States is founded on the backs of the indigenous and on the labor of the formerly enslaved. Those people whose labor power and land were the essential ingredients for the basis of the wealth of the United States of America is an indispensable ingredient in understanding the resources that this nation has in the 21st century. But the lesson that we too often forget, and the one that it seems to me we have another occasion to face squarely, is that our economic system has always thrived on sacrificing a certain number of lives based often on race and economic circumstance, a system designed to not only extract fossil fuels, but to harness human labor for maximum efficiency and maximum profit. How else to explain both the 400 years that we have looked back in this past year on 1619 and the founding of slavery, or the first Africans to arrive in British colonial America? How else to look back on the fact that at the end of slavery in 1865, we built a brand new criminal justice system in the South for the purposes of leasing convicts to private enterprises, not just a solution to create the industrial economy of the New South, but also a solution to solve the cost of incarceration. In the low tax states of Alabama and Mississippi and Georgia, then about 100 years behind their higher tax states like Massachusetts that had long invested in criminal justice systems, the solution in many ways to the political problem of mass freedom and the economic problem of no longer having enslaved people was to design from scratch, more or less, a criminal justice system in the South that would combine those two needs: the political imperative of controlling Black labor and the economic imperative of exploiting them. So then we see 100 years of various forms of that arrangement, from sharecropping on one end to convict leasing on another. We see movement of migration of African Americans, of Mexicans into the nation from the South in search of greater economic opportunities for themselves based on their own terms. And we see the metastasization, the growing sweep of the use of state violence for the purposes of controlling that movement, often by virtue of what police officers were charged to do. And so in places like Chicago and Philadelphia and New York and all around the country, Los Angeles, from sea to shining sea, policing took on a more expansive role in an age of migration, an age of industry, an age when the economy was growing for millions of white working class Americans. And that brings us to one important concept in this moment, that the jail itself has been part of an infrastructure for the manifest dreams and hopes of economic expansion in America. And so it's not an accident that in a time of coronavirus, we're having conversations about who lives and dies, about whether or not there are enough ventilators in hospitals. We know, for example, that in Brooklyn, one of the biggest hospitals, public hospitals, doesn't have the basic infrastructure because of leaky pipes and broken windows and poor medical equipment, while in Manhattan, private jets have been used to fly in N95 respirators, happening right now in April of 2020. And so this relationship of certain kinds of investments in criminal justice for racial and economic control versus saving white lives in this nation, by and large, is the conundrum and the challenge that we face in this moment. Immigration control is not just about fairness. It's also, in our time and in the past, about maintaining a sense of whiteness as the core value in American society. And so as much as the kind of straight talk that we hear in our public health conversations about the need for social distancing, the need to take seriously the warnings of the contagious infection rates of the coronavirus, we need to borrow some of that same courage and some of that same candid and face the facts of our historical past. Because the only way to come to the conclusion that, as the abolitionist thinker and scholar and someone whose work I look up to, and I encourage all of you to do the same, Ruth Wilson Gilmore reminds us in this moment, as she often does, where life is precious, life is precious. And so we make the choices that we need to make to break from our past, not just to reimagine possibilities, but to walk in the footsteps of the activists and the organizers and the people who are on the ground making real the possibility that fewer and fewer people would never walk into a prison or a jail in the first place. That those places of investment in the economic extraction and the political control would once end, finally, in a nation that purports to be a land of freedom and democracy. And so let me remind you as I close that where life is precious, life is precious. And therefore, we have to rebuild an infrastructure of housing, of economic security, of food security, of the kinds of core things that matter when white lives have often mattered first. We can take our cues and we can rebuild an America that means something different than it has in the past. Thank you.
Good afternoon, everyone. Thank you, Khalil, for that important background and the challenge that you've offered us for our discussion today. You've clearly shown us the way in which our criminal justice system has always been inextricably linked with questions of political power and economic power, and has driven decisions about the availability of infrastructure and investment for health, safety, and even life itself. My name is Catherine Huffman, and I'm the Executive Director of the Square One Project. Thank you to all of our viewers for joining us today for this important conversation. I'm very pleased and honored to be joined today by this incredible group of people. Melissa Nelson is the state attorney for the 4th Judicial Circuit of Florida, based in Jacksonville, Florida. Emily Wang is an associate professor in the Yale School of Medicine and the director of the Health Justice Lab there, which is a collaborative, innovative, interdisciplinary team focused on improving the health of individuals and communities impacted by mass incarceration. Robert Rooks is the co-founder and vice president of the Alliance for Safety and Justice, based out in California and working nationally. And Pastor Mike McBride is the national director for Urban Strategies Live Free campaign and the founder of the Way Christian Center in West Berkeley, California. This moment of crisis and extraordinary upheaval has brought us in many ways into a square one moment, whether we like it or not. Foundational change is happening or could happen. For both better and worse, things that seemed impossible are now clearly possible. And we're at a moment where we can put everything on the table to think about protecting the health and safety of all. How do we care for each other now and at the same time build a future that's safer, healthier, and more economically and socially sound? We're going to start this part of the conversation today hearing from Melissa. Melissa, over the recent weeks, hi, thanks for joining us. Melissa, over the recent weeks, you've been involved in leading the adaptation of the state court system in your district there in Florida to meet the needs of your community. And I've also been looking at ways that your prosecutor's office can assist in reducing health and safety of people in the jail, people who work there, and those in the community. Tell us more about what you've seen and how you've responded to these urgent challenges.
Sorry, Catherine, I was working on the mute button.
That's quite all right.
So actually one of my colleagues and fellow panelists, Dr. Wang, actually reached out to us a few weeks ago to share information with us that was important for us to consider about the danger, as we've seen in other jails and prisons, of the virus coming into our local pretrial detention facility. Reading about that, learning about it, we actually instituted a protocol, an initiative here at our office called the Expedited Resolution Initiative. So like in any jurisdiction, we work on statutory timelines by which we have to make decisions. Because court is down, depositions are down, our lawyers are working remotely and have more time to make decisions and to address issues before them. And so we said, ignore the statutory timelines. We're going to speed those timelines up. And we issued a written directive as to the protocols we were instituting with the goal of reducing our pretrial detention population. And so we've done so. We're directly attributable our efforts to a 10% reduction. There's right now, at the high, it was a 20% reduction. Currently, it's a 15% reduction. Obviously, police are making arrests every single day. And so that reduction has been sustained over the course of the last now almost 4 weeks. And we've allowed the jail to now create space so that they can allow social or better distancing and allow provisions for medical quarantining, which they didn't have at the beginning of this initiative. So it's certainly for us been a square one moment to look differently about how we go about making our decisions. And we will not know, we still do not have a positive case in our jail, which is a wonderful thing. And we have no idea if our efforts have actually attributed to a crisis averted, but we feel good about the work that we've done, and we certainly know it's made a difference in the population.
Great. Thank you so much for that update. And that's a perfect segue for us to turn to Emily Wang. Emily, welcome. Melissa was just talking about some of the work that you all have been doing together and talking about the challenges facing individuals and communities attempting to meet the needs of people who are involved in the justice system, particularly with regard to protecting their health. Tell us what that looks like from your perspective as a medical provider. What's been happening in your practice, and how have you been able to meet the fast changing needs of the population that you're serving in this moment?
Thank you so much, Catherine, and it's nice to see you, State's Attorney. So, it's a real pleasure to be here this afternoon. And as you guys know, my practice for the last 12 years or so is really caring for people that are returning home from prisons and jails. And what we knew before were that the health risks were extraordinarily high when individuals are released from jails and prisons. And this includes high risks of hospitalizations, high risks of deaths from overdose, heart disease, cancer, preventable conditions, and individuals that are justice involved had a hard time getting into primary care, getting basic healthcare needs met. And so now with COVID-19, as we all know, the virus presents significant health risks for those who are justice involved, those who work in the carceral system, and families and communities to which they return. And there are a number of reasons, again, that include kind of this high throughput, people going in and out of jails, high rates of asymptomatic infections that we're actually seeing out of prisons where there are kind of robust testing programs, ranging from 60 to 80% of individuals that are tested actually are either asymptomatic or pre-symptomatic with the infection. And then what State's Attorney mentioned, which is that many jails are actually unable to take on the most important prevention or mitigation measure, which is socially distancing. And so, fortunately, in this square one moment, many jails and prisons are taking on, never before, at least in my lifetime, plans for larger scale release. But what it means, though, is, the risks of returning home were already high, that these individuals are now placed at incrementally higher risks of release once they come home. And so, I share with you a patient that we just saw last week in clinic, a 50-year-old man who was at the end of his sentence. He should be released, and he has end-stage renal disease, needing a placement in the community for dialysis. And that's really hard to find a place for dialysis. It's infinitely high, much, much higher to find a place for dialysis in the community. And so, our healthcare systems are shut down. The primary care practice that I run now does everything by telemedicine. And for this population, what we need is an all hands on deck approach to saying that they need increased entrance into a primary care system that never was really structured for them before, but now more so than ever. These systems place these individuals at risk, and it means the correctional system needs to be doing its part, but also our community health system really needs to be doing its part. And so in Connecticut, what we've done within our Transitions Clinic network is started a statewide hotline so that any discharge planner, parole officer, halfway house can call a single point to kind of create a medical transition for people to come home from prisons and jails. And what that means is we're trying to get 90 days of medication, trying to get ID, trying to get them access to a phone so they can actually do telemedicine. Again, all the primary care clinics are closed. It also means increased partnerships, that when we think of this notion of, where life is precious, it means all hands, that our community health systems have to be responsive, but so do housing, so do our food systems. And so we're really in Connecticut trying to create a wraparound program for people that return home. Because otherwise the consequences are large for the people that are returning home, but they're also large for our community. That, you know, in order to flatten the curve for our healthcare system, it means that we have to keep individuals who return home from jails and prisons safe, healthy, in our primary care system and out of our emergency departments and hospitals. The last thing I'd say is that we've really been pushing to have increased data around who is actually being released and what are the kind of health conditions that they're coming across when people come home from prisons and jails. And I end with just a brief note. Our chair of the Department of Medicine, I think rightly so, released data showing kind of the disproportionate rates of COVID-19 in poor communities within New Haven as compared to richer communities. And it was about a 50 times increased rate in the poor communities in New Haven. And, you know, there was a front page article kind of highlighting this disparity. And in it, the only patients that were mentioned were our patients in clinic that had all been justice involved. And so until we have a clear lens on how COVID-19 is impacting kind of racial and ethnic minorities, and especially justice involved individuals, we won't really know how big the scale of the inequities are and how best to mitigate it. So this has been a real transformative time, I think, for our healthcare system to rethink how it is caring for people that are returning home.
Yeah, thank you, Emily. Thank you so much for that. And that's really, it's just so striking to hear those numbers and in particular, the ways in which your work is elevating the cases that are so important in this conversation. You're highlighting also the importance of community leadership and engagement in these challenging times. And I'll turn for a moment to Pastor Mike to talk a little bit about this as well. Welcome, Pastor Mike.
Welcome. Glad to be here. Thanks for having me.
Great to have you. We'll see if we, oh, great. There you are. Now I can see you. Hi, Pastor Mike.
Hey.
I'd love to hear from you, Pastor Mike. I know you and many partners have been focused on identifying some of the gaps in responses to the needs of communities in this moment of crisis and urgency. Can you talk about some of those gaps that you've been able to identify and what you've been doing in your work to try to fill those gaps, what we can learn from that?
Yeah, no, absolutely. And thanks again for all the comrades. It's great to always be with Square One and keep challenging us to reimagine justice, to start from zero, from square one, if you will, and bring a radical imagination how we shift these very damaging systems. For many of us who are on the front lines of the work in our communities and in our societies that are not always deemed as work that is dignified, work that gives us a livable wage, work that we dare say is considered essential. When this virus hit, for many of our families and loved ones, we began to see that, as the old adage says, when America gets a cold, the Black community gets pneumonia. Well, we who are in the community knew already that before COVID hit, we already had pneumonia, and now we are dealing with a epic public health crisis that is the result of decades, if not centuries, of terrible inequities that are about systemic and structural exclusion. And so because many of us were on the ground doing all kinds of work related to gun violence prevention work, doing work to try to change and change the systems that incarcerate too many and decarcerate many of our jails and prisons, because we were a multi-faith, multiracial network of faith congregations all across the country, we had all kinds of intel very early on that were hinting at a disparity that would blow our minds. And the added insult to what we were hearing were that our loved ones in jails and prisons were being withheld care. They were being withheld PPE. They were not able to social distance. As a matter of fact, in many of the conversations happening at the supply chain level among many partners and folks in the medical profession, they were already kind of setting a triage hierarchy that said that our prisoners and others would just pretty much be written off. And for us, we began to just say that in a pandemic, in a public health crisis, no life is disposable, that we cannot approach this pandemic already writing off lives. And so a number of us got together and we partnered with some national influencers like W. Kamau Bell, Coach Steve Kerr, Alicia Garza, Erica Campbell, a host of other folks. And we started the Mask for the People humanitarian campaign. It is an effort to get PPE to our loved ones who are in jails and prisons. It's an effort to amplify that we have essential workers who are not doctors and nurses in hospitals, but they are frontline workers who are doing violence prevention and interruption work. They are individuals in our congregations and our neighborhoods who still have to go to work every day as work in supermarkets, go to work every day driving buses and delivering food to children because our schools are shut down and they need PPE. So we felt it would be very important for us to be what Dr. King called us to be, ambulance drivers, blaring through red lights in a crisis, declaring that we have an emergency on our hand. And rather than us just cursing the darkness, we said we would step into the light. We would raise as much money as we can. We put a goal at $1 million to get PPE to hand it out free all across the country in some of our most hardest hit cities. And we're so excited to be able to not only have gotten the initial goal that we set of $1 million, but today and tomorrow and later this week in Chicago, in Atlanta, in New Orleans, in New York, in Milwaukee, in Chicago, in the Bay Area, in Los Angeles, Birmingham, cities all across the country where we're doing our work, we're be able to put that resource on the ground for folks. I will just say to us that part of our task in this moment is to unleash our imagination, to not allow the wickedness of this current administration, the insufficiency of their leadership to paralyze us, as to cause us to turn inward. This moment requires for not only a radical reimagination, it requires a radical solidarity, a radical charity, a radical generosity. It requires us to figure out what is in our hands and what can we do to provide both mercy and justice. And I don't find those two to be at odds with one another. I think our greatest learning in this moment, as Alvin Herring, our executive director of Faith in Action, says, if you show up with hope, people will hand you their hopelessness in exchange. May we, in this moment, may we show up with the hope of mercy, with concrete material solutions, and may we show up with a radical reimagination of this system and these structures that continue to perpetuate the loss of lives unnecessarily. So the Mask for the People is our effort to try to respond to that. And we stand in solidarity with all of our comrades all across the country who are doing the great work from different parts. And may we continue to resist not just the virus, but the mendacity and the wickedness of this current leadership that continues to cause needless deaths. This is our task and this is our call. And we're glad to be able to be in partnership one more time with all of you to make that happen.
Pastor Mike, thank you so much for that report and that inspiring encouragement that we all step into the light and think about the ways in which we can be radically in solidarity together. That's the perfect lead in for us to hear from Robert Rooks, who is at the Alliance for Safety and Justice. Robert, welcome and thank you for joining us for this conversation. Robert, I know in normal times, your organization, ASJ, focuses especially on the needs of survivors of crime and identifying ways that community resources can be put into service of their healing and their safety. That seems never more relevant than now. Tell us about your reaction to this moment and what ASJ is doing in response.
Thank you so much, Catherine, and good to be on this panel with these fine folks. I first must begin by just sharing that I'm worried. I'm worried about who's dying from COVID-19. I'm worried about the future, who will shape it and who will not be able to shape it. I'm worried about our history, for when bad things happen, systems often emerge in the name of safety that are impactful for Black, brown, and vulnerable. And pandemics have a way, for certainly this pandemic has a way of showing the true fault lines in society. In Michigan, Black people account for half of COVID-19 deaths and only make up 14% of the population. In Louisiana, 70% of those who have died are Black, despite 32% of the population. And in the face of that just unspeakable reality, people have the audacity to protest, and governors debate when to open economies, and we have yet to figure out what we're going to do for the most vulnerable. And so this time, it's a time for us to think about what we've done wrong in the past and figure out what we can do in the future. In the 80s, for example, when we saw addiction to crack cocaine throughout our communities, we responded with an irrational fear that resulted in expanding the justice system to where we have it today. We responded in irrational fear because we othered Black people and we created Black people as the enemy, as opposed to building out a public health infrastructure that we could use in times like this. You see, this moment is a time for us to really focus in on how do we move forward in the wake of COVID-19. I asked my organization to begin calling our early to 80,000 members. To date, we have called 5,000 members, had 5,000 conversations, and we came up with 3 important needs. One, telehealth needs need to become real. We do not have the infrastructure, computers, and Wi-Fi for this at this time. 2, trauma counselors and reentry providers are stretched, many having to turn people away. And 3, we must engage in federal and state policy in order to shape the future for tomorrow. In every major crisis, governments pass policies, and those policies end up being long-lasting. Since we know where this is going, our organization is shifting our priorities. First and foremost, we need people released. We need to release everyone from prison who do not pose a risk to themselves or public safety. We can achieve accountability without incarceration. Number 2, we need a stimulus package that will incentivize policies that reward states for closing prisons, growing alternatives, and restricting resources to the states that do not. Third, we need to build the public health infrastructure that should have been built in 1980. One that invests in community first responders, victim and trauma supports, reentry providers, community-based interventionists, locally based mental health and substance abuse programs, and restorative justice. And 5, which is deeply personal to me, many calls to 911 are mental health calls and not law enforcement calls. We need to take, as we talked about in Square One before, take 911 out of the police department and into mental health units so people can respond. I myself lost a close friend because police answered the call, not a mental health worker. We must place our collective humanity first. This is a time to move in a direction where we support real crisis assistance, real access to health, real access to fair wages and education. Because if we do not, America will never be safe from a disease or from our own dangerous imagination.
Robert, thank you so much for that direct advice and for the perspective that you've been able to bring from the conversations that you've had. I really appreciate the words from all of you thus far, and I'd like to bring back in all of our speakers so that we can have a bit of a conversation here together. Great, thanks everyone. And we're joined again by Khalil as well, so that he can join in this conversation. I have a few questions to get us started, and for our viewers, please feel free to put questions into the comments if you haven't already been doing that. We'll do our best to answer a few of those, and it'll help us move the conversation forward. So I want to start with Emily and Melissa. You both talked about unprecedented changes within the justice system in this moment and in the community health system as well. What is the potential for sustaining those changes? They're big and they're dramatic in the moment, but they don't come easily, and it would take quite a bit to have them continue. What's the potential for that, and what would it take to make that happen on an ongoing basis?
I'll take that question. I know that I can let Melissa, the state's attorney, respond. But from the health system side, I mean, I think that we've seen huge transformations happen that, policymakers, healthcare administrators have been working on for decades. And Robert references telemedicine. That's something that never before have we seen kind of the kicking off of telemedicine, where primary care clinics, urgent clinics, even the prescription medications that do treat for opioid use disorder in an overdose epidemic now can be prescribed without an in-person visit. They can be prescribed by telemedicine. So it's transformative. And still, I think what's important to keep in mind is that they won't be transformative for the patients that I care for communities that are without the resources to even have a phone with the kind of a plan that has the telemedicine capabilities. And so there is the real risk that even as these transformations take place within our health system, that large swaths of the population, poor communities of color, will again be left behind. And so this here, I think, is the real kind of accountability that we have to hold ourselves to within the health system, but our communities too, as well, is to say that this can't move forward in this way without really thinking about how best to protect our most vulnerable.
Thank you, Emily. I want to give Melissa a chance to respond to that as well, but also Robert, you were nodding your head there, and so if you'd like to jump in for a minute on that topic as well, please go right ahead.
Yeah, no, I was just in agreement with Emily's comments around just our concerns around telemedicine and telehealth. I referenced that we've been making phone calls, and we were talking to both members, people who are victims of crime, who have had challenges connecting with their mental health provider, utilizing telehealth, and there's just a lot of structural barriers in their ability to connect. There's Wi-Fi surcharges, there's HIPAA laws, which I think some have been relaxed for this. There's just the infrastructure and computer needs. Some of the providers aren't were not ready for this. So it's I worry because there's a lot of society in America that will benefit from telehealth, but then there's a lot that will not. So when Emily laid that out, it just spoke to my spirit.
Yes. Melissa, you've been working on this in a very concrete way on a day-to-day basis, working with people who are charged with crimes, people who are victims and survivors of crime, the lawyers and various institutions that have to navigate all that together. What have you been seeing that has changed now that you think could be sustained going forward, and what would that look like?
Well, one of the things that I definitely think going forward will be sustainable is the level of partnership, hopefully, and teamwork that I've seen work across traditionally adversarial stakeholders or stakeholders who don't generally work together. We've worked, as I mentioned about the Expedited Resolution Initiative, we've worked hand in glove with the correctional staff at the jail, and they've been incredibly appreciative, but we're in constant communication with them. We've worked with the private bar, the judiciary, and the public defender's office. While we work with them daily, we've worked with them in a different way. And I think it's been, well, I know it's been very positive, and so I suspect that will be sustainable. As we've operationalized court remotely, one of the things that's been important is obviously that we communicate with our crime victims and inform them about our decision making. I suspect as we continue remote court, that this will be something in particular that may alleviate the burden on crime victims to stay abreast of criminal prosecutions and their cases. victims of crime or families of victims often have a very difficult time navigating the criminal justice system. To follow a case in court means taking off work, coming downtown, finding parking, sitting through a docket for potentially hours. And if our court continues remote, as I expect that it will, and begins to live stream, this will alleviate great burdens on people, the public, generally, beyond just victims of crime, but people who have an interest in the court system, to be able to tune in and stay abreast of a case without the physical burden of being there, meeting the logistics of it. And lastly, I'll say, right contemporaneously with the pandemic, we started a notification system, a text notification system for the public, for people who are particularly interested in a particular case, to follow it. That has been served as a godsend to us for informing and communicating with our victims as we've gone forward, because access to the courts is obviously very important and important to the public. So those are a couple of things that I think that we'll see as sustainable going forward.
Thank you. That's great. We're getting some questions in our feed about some of these ideas that you all are getting to. What are some of the ways in which we could concretely be looking at sustaining these changes going forward, and in particular, what are the things that we'll have to be on guard against as we do, to make sure that we're not finding ourselves backsliding. I want to go back for a second to some of what Robert and Pastor Mike brought up. Robert, you talked about the fault lines we're seeing in this moment, and that there are examples from our recent history where we've not handled things well and have responded with fear and identified enemies rather than coming together. Pastor Mike was talking about the need for radical solidarity. From either of you, or I also want to ask Khalil, are there examples of times in the past that give us an example of success in these ways? Or are we instead looking only to cautionary tales that we need to avoid falling into? What would you point us to as we're thinking about how to sustain this connectivity that so many of our panelists have talked about, in this way in which many people are working together? Khalil, I'll let you get started on that if you don't mind.
Sure. I mean, so it's a great question. I think that our usual examples of coming together tend to reinforce these moments of war that require great sacrifice. But I think that distracts from the ways that crises, both past and present, tend to reinforce hierarchy and the evidence of structural racism and disadvantage. So I'd like to reframe the cautionary tale to look precisely at the way that communities that have been most often most vulnerable in moments of great crisis, and we can use Hurricane Katrina, for example, to identify the ways that communities work in spite of the state providing the kind of assistance and priority of the needs of those who have often been left behind before the crises. And in that, there is a very rich history of community-based efforts to survive not only great tragedies, but also to find creative ways to work beyond what the state is rationing or the provisions that the state offers. And so in the case of the great man-made and natural disaster of Hurricane Katrina, a lot of Black communities were able to rally together to put together various housing policies and programs that were beyond what the state was offering. And this is an important example because this shows us the way, in a sense, of what the most vulnerable will do if left alone and not subject to the kinds of oppression. So in the case of the COVID pandemic, one of the great reveals in this moment is not that Black and Brown communities are already suffering from divestment. It's that they're suffering from divestment plus being asked to sacrifice as essential workers where they're already disproportionately overrepresented. So the cautionary note is that you've already extracted from the most vulnerable communities and then put the burden on those communities to be the ones who are delivering the food, which only reinforces the hierarchies and the social hierarchies that already exist. So we could talk about various degrees of lessons here, but one lesson would be don't ask the community that has already suffered the greatest burdens of social, economic, and political divestment to then bear the burden of saving the rest of the community from a natural or man-made disaster.
Mm-hmm. That's, oh, Robert, go ahead. Do you want to jump in?
Yeah, no, just in terms of the opportunity and risk of this moment, safety is at the center, right? Safety is at the center. If you get on conference calls, you often check in with people. Hey, how you doing? Are you safe? When you go to grocery stores, you need to make sure you have your mask and make sure you're being safe. Even when you go to the doctors, people are choosing whether or not to go to the doctors based on their safety. So safety is at the center right now, and that presents both a risk and an opportunity. It's a risk because in the past, when safety was at the center, it generated a sense of perceived fear that resulted in mass incarceration that we have now, right? So we know that. It's an opportunity today because we've learned our lessons from the past, right? And we can build coalitions to truly own safety. Like we can bring coalitions and organizations, groups on the ground, ranging from crime victims to people with felony convictions to service providers together to say, no, we cannot go back and do what we did in the 80s. We need to create new systems and structures to really make communities safe and make sure there's safety for everyone. Yeah. Newark community street team right now, just in New Jersey. Mayor Baraka and folks there, law enforcement support, interventionists going into community, negotiate peace. They have been playing a significant role during this time in COVID-19 to ensure that people stay home, that they shelter in place, to make sure people have what they need. They're supported by government and invested in, and Newark has seen significantly lower rates in terms of crime than before. So safety is at the center, but it's the opportunity.
Thank you. Y'all are both highlighting some of the themes that we've been seeing emerging in Square One's work in a lot of different ways. The ways in which community leadership and genuine connection and coalition building can really be at the center of creating a type of robust safety that benefits all. And that sort of civilianizing of safety, as we've been calling it, is just really crucial as we think about how we're responding in this moment and are recognizing the interconnectedness of health and safety in so many ways. I hate to say this, we're going to wrap up this part of the program and look to Bruce and Vivian to take us out. But I want to give Pastor Mike the last word, and I'll ask the preacher to be brief in answering a question about what are the values that you would encourage us to keep front and center as we're making these decisions and deciding where we go from here. Is there an overriding value that you would say should be driving this conversation, Pastor Mike? Pastor Mike, I think you might be on mute.
Can you hear?
Yeah, there you go. Oh, wait, I'm so sorry. It just disappeared again. Try one more time.
Hello?
Now you're good. Try that. Yep, you're back. Thank you. It's not a webinar without a direct malfunction. Go ahead.
Yeah, we will get through this crisis, and we will have a lot of rebuilding. We will have a lot of healing and recovery that will then be left in our hands. And so I do believe that process starts now. We may be in a valley of dry bones, as the prophet says, but we must speak to the winds. Some of the winds we've been relying on in the past have brought us to this point. So we must look for new winds, new sources of life. We must reimagine the way we talk about these challenges, the way we talk about those who are the most impacted by these challenges, the way we talk about many of us who are some of the advocates and champions of this new world that we have to create post the coronavirus. And so I will just compel us. Let us resist the language of war. We are not at war with a virus. A virus is a part of our human ecological systems. We're no more at war with a virus than we are at war with a tornado or an earthquake. What we are at war with is the fragmentation and fracture that often is being used by the powerful to pit us against one another. And so may we respond to this moment with a new imagination that allows us to see into the future, the world we want, and use this as the opportunity to bring us all along in a shared vision of belonging and inclusion and healing and hope. We have that within our hands to do. So may we put our hands to the plow and get that job done.
Thank you, Pastor Mike. Well, with that call to action, I'll thank all of you for joining us in this conversation. Thanks to the many folks who submitted questions, and I'm sorry that we weren't able to get to all of those. But we will now hand over to Bruce Western and to Vivian Nixon to talk with us a little bit about where we go from here in the future. Thanks to everybody.
Hi there, Vivian.
Hi, Bruce.
It's good to see you.
Same here.
So it's been a pretty extraordinary couple of months that we've all endured and lived through, truly disastrous. And yet I feel we've learned something about ourselves as a society. Our job in closing this conversation is to look forward. What do you think we've learned about our society, and what lessons can we take to help us move forward?
You know, I've been struggling with the charge that we've been given to look forward, because actually what I've learned from these past 2 months is how much history has to teach us in this moment. And I think that it doesn't hurt us to remember that we've been here before. And I see this moment in relationship, at least to criminal justice, and all of the other accompanying factors that we're looking at that are damaging the most marginalized population, as a third opportunity to get Reconstruction right. Because it really isn't just about one thing. It is about many things coming together to expose what the real issue is. What we are seeing now is persistent symptoms that have revealed themselves over and over and over again in American society. And so now it's time for us to fix the wiring. You know, I think of it as if I was having a problem with an appliance in my kitchen because it was broken, and I am so busy tinkering around fixing that appliance, and I don't know that it's the wiring that's broken. And that no matter how much money I spend fixing the microwave, if I plug it back into that same broken wiring, it's not going to work.
Right. Yeah.
And so looking toward the future, I think we need to fix the wiring.
So I heard a lot of different points of optimism in the previous hour, listening to Melissa Nelson and Robert Rooks and Pastor Mike McBride, and amazing things, cataclysmic things are happening within our criminal justice system. If we think about Rikers Island here in New York City, in the last month, some 1,500 people have been released from a jail that in March, the population numbered 5,500. Mm-hmm. And Melissa Nelson spoke to that, and Robert spoke about the importance of coalition, and Pastor Mike appealed to our collective imagination. Are these tools in the toolbox to fix the wiring, do you think, or how do we do this?
Yeah, the tools are definitely in the toolbox, and there's been evidence in 2 previous reconstructions that the tools are there. Right after the first Reconstruction, there was tremendous progress in different coalitions of people coming together. They sent Black people to Congress. They talked about education for all. They talked about fair wages. And then in the second Reconstruction, we brought African Americans into the safety net and gave them access to all of the civil rights. We did all of those positive things when we acted in coalition with other people who were also in some way disenfranchised and marginalized. What we have got to do is not let the same power structures that broke up those coalitions with the Southern strategy, because those coalitions were working, they were doing their job. We've got to not let those coalitions be broken up again with the same strategy that has worked for the past 50 years.
That is so interesting. We can think about this history, our history, American history, as moments of breakthrough followed by retrenchment and backsliding, in which the old racial hierarchies, the old class hierarchies were reconstructed. We're seeing a breakthrough, or we're seeing some breakthroughs, evidence of some breakthroughs now in the decarceration project that has become emerging really as a best practice. And the challenge, as I hear you, is resisting the retrenchment, resisting the backsliding, in which the old forces of power, of racial hierarchy, of class inequality, resisting the resurgence.
Yes, which is driven by fear. It's driven by fear that if we push too far, that the retaliation will be even more severe.
Yeah.
What it's going to take us to realize is that together we are stronger than the forces that are against us. But it is going to take some sustained movement building. Yeah. And we cannot fall back and stop pushing against the ocean just because it looks too big. And, we're in this political moment where even our politics are not the problem. They are a symptom of a bigger problem. And we've got to keep fighting that bigger problem. What we need now is movement, not moments. We need serious, sustained, progressive movement that is not afraid to go beyond what is easy to do and is willing to take on the hard problems, because at our core, when we join with others who know what is best for us, we are more powerful than the opposition.
I totally hear you. I feel that the great moments of social progress in American history, they never originated with sort of brilliant experts who were devising great solutions to social problems. They were propelled by organization, the hard work of politics, of building coalitions, and I feel that the pandemic has opened a door, right? It's opened a door of possibility, and I think in the past hour we heard two possible futures, right? One is more inequality, the rush to safety that Robert spoke about in moments of real destabilization. People do become fearful. That's one future. But the other future is one in which we affirm our common humanity. And this is kind of the great threat of the pandemic, I think, but also the great lesson where now our whole collective fate as a society is intimately tied to the well-being of the most vulnerable people in our community. And if we if we can improve the well-being of the most vulnerable people in our community, if we can join in those political coalitions that are trying to speak up for the interests of the most vulnerable people, then society as a whole will be better for it. I do think this is a justice moment. An opportunity is there, but as you say, capitalizing on it depends on this hard work of organisation and building coalitions. And I think for me, I think it shows that the failure, you think of, the failure of mass incarceration wasn't chiefly a policy failure, it was a political failure. And the solution, retreating from mass incarceration, finding a way to public health in poor communities is ultimately a political shift, not a policy shift.
It's a political shift, and it's going back to a place where those who have been convinced that there is an aristocracy in this country that has a tremendous amount of power, those who are convinced that they are in the same camp with that group, but who are just as neglected and marginalized and impoverished and now being called essential because they work in the big box store when they were very expendable prior to that. Though they may not be the population that is most incarcerated, they are marginalized in other ways. They are starting to see the ways that they're being left behind, because this virus, though the impact is seen at this moment, it is seen in African-American communities to have a severely disparate impact. When this virus starts to hit other the Appalachian communities and other communities in the middle of the country and more rural communities that also don't have good health care and good hospitals and resources, there's going to be evidence that we have more in common in terms of what we're up against in this burgeoning aristocracy that is happening to us, that we have more in common than we have apart. And in that way, this may be an opportunity for us to do what has been done before, to have a multiracial, multi-gender, multi-ethnic coalition of people that have stood up and said, we can do better for everybody. Obama wasn't the backlash wasn't against Obama. The backlash was against the Obama coalition because it was so diverse. When Reconstruction was happening, people don't realize this, but if you read deep enough into the history, there was actually conversations about Frederick Douglass being president. That's how coalesced people were at that moment. Well, those coalitions can exist in this moment because we are all equally susceptible to this virus, maybe in disparate amounts, but death is death, whether it happens in Harlem or whether it happens in New Orleans, Louisiana, whether it's happening in Michigan or Wisconsin or Appalachia. When death comes to these communities, there's going to be evidence that we are all at risk, and we can all help save each other.
That makes me hopeful that there is a tiny seed of justice in this pandemic, that our fates are joined, that we should care about each other. And I think that has been missing from our politics. And it gives me, it gives me optimism. And maybe that's the potential of this moment, that our fates are joined right now.
Our fates are joined together, and optimism is a wonderful thing. But every time there's been real change in this country, it has taken more than optimism.
Yep.
It has taken courage. It has taken speaking truth to power. And it has taken folks recognizing who their allies really are and taking a stand and working together in very diverse coalitions that some people have to give up some power. We have to consolidate resources in a way that builds power instead of doling out resources in a way that disperses power. There's a lot of work to be done, but it can be done. But let hope not be all we have. Let us merge that hope with some real motivation to act and to move and to empower people to take the situation into their own hands and to embrace a condensation of resources so that we can build power.
That is the perfect note on which to end this conversation. It's so good to see you, Vivian. I've missed hanging out.
We need to hang out.
We definitely do, and that's at the top of my list as soon as we're able. So while this town hall is ending, our campaign, Justice is the Next Normal, is just beginning. You're going to be hearing a lot more from us over the coming weeks and months, and we want you to join us. So follow us on Twitter, on Facebook, and visit our website, squareonejustice.org. We've received a lot of questions from the audience online. This conversation is going to continue on Twitter, and so you should follow us at SquareOneJustice, #1Justice, on Twitter. Thank you again to all our participants today and to everyone who joined us online. Good afternoon.